Hi, everyone. I'm so happy to be here today. So my name is Fabien Beckers, and we're going to have an incredible panel with us today to really talk about telehealth. And I'm thanking Bene Studio to give me the honor to have the chance to talk about this incredible topic today. I think there's not a better time to really talk about telemedicine, telehealth. We've all been impacted by the severity of COVID. And so I think now is really the time to, more than ever, really bring that disruption together and really accelerate digital transformation in healthcare. So really happy to be there. As I said, disruption is not a choice anymore, it's an obligation. So very happy to have the conversation. So just to, today we're going to talk about telemedicine and the potential it has. There's been a lot of talk about telemedicine being the great unlock. I think before COVID, it was a $3 billion market, which is becoming a $250 billion market. There's been some academic sites that were at just like 6% telehealth. They went to 80% after and during COVID, and thinking to be afterwards 60%. And so this is clearly a massive change and probably one of the biggest transformations in healthcare has ever seen. People talk about 5 to 10 years acceleration in telemedicine and digital health as a whole. And so very excited to chat today. So we have an incredible panel today, and I'll start by letting them introduce themselves. Ajala, if you don't mind starting and talking about yourself, that'd be wonderful.
Sure, thank you for having me. So my name is Ajala Ngarndi. I'm a board certified emergency medicine physician. I would probably say about a year or two ago, I got involved in telemedicine, just providing more like urgent care services to patients. I worked with a company for just a short time period. More recently, last year, I became the medical director for the Atlanta division of the UBERDOC. And we integrate both telemedicine services and also home healthcare services to patients, where the patient requests IV treatments, including IV vitamins, have a consultation with the provider via telehealth, and then we send a registered nurse to provide that treatment for them. So that's a little bit about my background.
Thank you, Ajala. Uli, if you don't mind.
Sure. I just introduced myself, but I'm going to do it again because this is a different panel. My name is Chettipally. Ajala. I'm also an emergency physician. I know emergency physicians are great because they are looking at the big system issues, always looking at the whole community. I'm an innovator, researcher, and I've retired from clinical practice to early retirement, but I love technology, and what I am doing right now with InnovatorMD, by the way, InnovatorMD is my company. We are elevating physician voice, physician innovators' voice, because we have seen a lot of products and services and technology that was started, and then it hits a wall, right? Because they cannot make the business into a clinically viable solution. That's where we think that physician voice is important, physician input is important, or physician involvement is important from the beginning. That way, you are going on the right track so that you don't hit this wall, you avoid that wall. What we do at InnovatorMD is we do conferences, we do courses, we do meetups. In fact, there's one meetup today at 4:30 p.m., which is our monthly meetup, which is free to anybody who wants to register. Every month we bring in physician innovators, physicians who are working on a project, doing research, or even entrepreneurs who have taken that research down towards commercialization. What we provide is this community, 40, 50,000 physician community. And you can find people that you really want to connect with. If you're a technologist, or even if you're a physician, you can check things with other physicians and make sure that you're going on the right path, because we want to help them succeed as they grow their innovation. That's what.
Thank you, Uli. We appreciate it. Craig?
Hi, I'm Craig Zevin. I'm the COO of UBERDOC. Unlike my esteemed colleagues, I'm not a doctor. I come primarily from the technology side. So I've been in startups for most of my career, primarily in the advertising and marketing space. My first jobs in high school and college were front desk at an infectious disease clinic, and then running my mother's midwifery practice. And so after a bout in management consulting and a few other verticals, I've come back to my roots in startups and in healthcare. So as the COO of UBERDOC, we are building a Cashpay marketplace for patients and doctors to connect. So outside of insurance and referrals and restrictions, just a immediate real-time transaction where patients can find free access to doctors, and doctors can get paid in cash immediately. And where we're really expanding is in the tools that we provide to doctors outside of booking and scheduling and telemedicine, which we currently have, to meet more of the ancillary needs that they're going to need to support their digital practice. And also to open up more avenues to patients for direct pay healthcare. So beyond just the appointment, their prescriptions and their lab work and any imaging, to really expand out what the market of cash pay healthcare can look like.
That's wonderful. Thank you all. I mean, I really love the fact having clinician and also startup at the same time, because I think it brings such an interesting perspective. So excited to have all three of you tell me what you think about it. So let's talk about telehealth, because I think there's a lot of, the word has been a buzzword for a long time, but what does it mean? Is there any sort of the broad spectrum? Some people think that it's just simply like taking a visit and making it on Zoom. I think it can be, of course, much bigger than that. Uli, why don't you tell us what you think is telehealth? What is the definition for you? And that'll be really helpful.
Sure. So if you look at the basic technologies, it's just a communication platform, right? Like telephone, like fax machine. But if you add the main ingredients, which is, how do you deliver compassion? How do you deliver, treatment? How do you deliver peace of mind? How do you deliver, specific treatment suggestions? That's when it becomes really powerful. So when companies come to me and say that, hey, I have a telemedicine company I'm starting. So the first question I ask is, how does it affect your clinical outcomes? If it is going to make a change in the clinical outcomes, that should be, your main focus. The technology itself it's great, and it's going to be great, and I have no doubt that we will have a lot of technological tools. But how does that affect clinical outcomes? How does that affect the patients? And that's where the bottom line is, I think. That's where telemedicine can.
And I really like the idea of starting on the outcome basis. Like, what do we want to do for the patient, and create a kind of patient-centric design form of healthcare, isn't it? I totally agree with that. And I think that's a good segue for Balint, which of course everybody knows for creating this amazing event. And Balint, what is your thought about how can startup and how can telemedicine, in your perspective of being connected to so many of them, what is it, and how far it can go as well?
Yeah, thanks for the question. Hello, everybody. I'm Balint Bene, CEO of Bene Studio, and I represent the consultancy aspect within this panel. So what we can see as a growth opportunity is definitely the niche markets. So now we have the big players of the telehealth world, and for startups, the biggest opportunity is to search for the niches and the less straightforward usage of the telehealth, where there are a lot of challenges, a lot of technical problems, human related problems. For example, nowadays still there are equipment heavy visit situations, which is really hard to manage remotely. To make it somehow remote is a big challenge for new startups, as we can see, and there is a human side of this story to establish the initial partner doctor relationship with the patient is really difficult doing online. So it's still more effective nowadays offline if the doctor would like to see the whole picture and would like to be really personal. So to simulate it remotely is also a challenge. What we experience is remote care works really well if the cure is focused, if it's an ongoing process, if it's an aftercare follow-up like a process, it's amazing. But if we need innovation, need creativity, then still nowadays personal meetings, ad hoc situations are useful, and we now we can't replace it 100%. So if we would have tools and platforms to help with this soft, more human aspects, then it's also a huge market opportunity, and we still have complex visit situations, which is difficult to do remotely. So these are the main areas which we can see for opportunities for startups.
That's really fascinating, because in one end you have Uli that says, look, we have to restart and rethink your healthcare around the patient, and you're saying, well, look, there's so many problems that are also put in for startups to redesign a new way to do like the new digital health of tomorrow in some ways. What is also interesting of both of your point is the fact that in telehealth today is maybe seen as purely a virtual consultation. But Ajala, I think you have a very interesting point as well. You say, well, telehealth is also good home health. And you really are leading that in your effort with InnovatorMD. So I would love to hear about your perspective of how you define from an ER doctor going to try to build new technology and new system for telehealth. What is your definition of it? Actually, I think you muted.
Yeah, sorry. Yeah, so I agree with the points that were already made about what telehealth is. I think it's very broad and versatile, and it can encompass different types of I guess medians and on how you connect with your patient. So in my case with the InnovatorMD, if it's like a returning customer, someone who I already know, it may just be a telephone call, and then we just have a discussion as to what's going on as far as like a health maintenance type thing. If it's someone who's having acute issues, I do like to do like a face-to-face kind of like conference call, or using a HIPAA compliant platform to connect with the patient. But having that extra aspect of having a nurse, registered nurse, go out, they become my eyes and ears as well, because there are limitations to a physician being able to fully assess the patient. Being involved in telehealth, it makes you realize all that as a physician, you do use all your senses when you're in the room with the patient. So having, not having all those senses there, it is a different encounter, but it's definitely something that I feel like a lot of physicians can adjust to and still adequately assess the patient.
And that's really fascinating, because you have maybe telehealth, maybe a partial view of the patient in some form, but when you do home health, you have even a more exhaustive view of the patient you didn't have before. So right. That's really even complementing it in some form. So now the question, so we have startups, we have some real way of redesigning healthcare around patient. We have a way to go to the home, but now we have to connect all these people together, isn't it? And that's what maybe Craig, you can come in and tell us how you think about what you did for telehealth and home health, and what you see it from your standpoint.
Yeah, absolutely. I think like when I think about defining telehealth, right? Telehealth in and of itself is like a complete misnomer, right? Like tele, even as a prefix, like doesn't even capture video, which was the obvious next step after phone. And so we've got this term that's a misnomer and not capturing all of what telehealth can be. And I think that Uli really touched on this, and Ajala as well. It's all of the other stuff, right? It's what you need to connect to make it valuable. It's the RPMs, it's the other services, because for patients, if they can do a video conference, but they still have to go in for their blood work, they still have to go in for their pick up their prescriptions, they still have to do all these other steps. You're not getting the cohesive value of telemedicine, whether that's for the doctor on the diagnostic and care side, or whether it's on the patient for the convenience side. And I think that's really important, because one of the things that Uli talked about was the end goal is improving care for patients. And I think that's absolutely true. It must be true for a doctor. That is a universal truth. On the flip side, patients can't effectively adjudicate care outcomes for themselves. So for telemedicine to work for patients, you have to have all of those other value props. You have to be providing value from the technology for it to work from a patient side. And that's not always perfectly aligned with just trying to drive the best care outcomes. So I think that with telehealth, it's about how do we bring all of those things together to provide cohesive care that leads to both patient satisfaction and value, and also better healthcare outcomes for the doctor.
Yeah, and designing from a new standpoint is a new kind of blank sheet now, because you have to start from scratch in some ways with new tools. I mean, I don't know, with all experience, Amazon, they can deliver something sometime for the next day. Why can't we do that with blood tests and other tests that can be on health as well? And how can we go and build on that to really have more home health, telehealth experience designed really around the patient experience? And what Ajala, you talked about, I think when we prepared the interview, is the fact of the benefit of, in some ways, when you have normal visits, you have a time constraint on your meeting of sometimes 15 minutes. But can you talk about what has been the benefit for you being providing home health, and what you've been able to discover through the new type of experience you had being at the patient home?
Right, exactly. So, so with our infusions, it takes about 30 to 45 minutes. So, after your initial assessment, you're there with the patient for that length of time, and you can really get to know the patient. People are more than just their ailments or, medical problems. Getting a good sense of their socioeconomic, or I should say more social support. It really gives you a good picture of, why the patient may be having challenges and let's say, treating their diabetes or, dietary issues, and, just having just a frank conversation with the patient. I do go on visits, but a lot of times it's the nurses that are also good at just kind of getting a better sense of the patient, and that way we can, in getting to know them better and really connecting with them, we can tailor their treatments more accordingly, and it is overall a better patient experience as well.
And see them in the home environment with their family and so forth. You were telling me how much it gives you so many indicators that you would not have had in the context of the confine of a meeting room at a hospital.
Right, absolutely. Yeah, if I see a patient in the ER, first of all, the time constraints is very tight in the ER. It's all about input and throughput, and so, and when they're in your space, you unfortunately, as a ER doctor, you don't really have time to kind of go through all the very important factors, like as far as like their diet, their support at home, things like that. You basically just treat their acute issues. Sometimes I feel like I'm just putting a Band-Aid on the issue as well, and getting them out. But so that's why I really appreciate this new experience that I'm having with home health. I can really just kind of slow down and connect with my patients more.
And it's ironic in a way that you had thought that through virtual connection, you may have very superficial connection, but actually it's the exact opposite, and brings a very much in-depth, comprehensive view of the patient that you never had before, which is ironic in so many ways, isn't it?
Right. Absolutely.
And I will bring the point of Uli that you were mentioning as well, is the fact that today we have this kind of very weird system building on point of Ajala from a medical standpoint, that we time our visit on a yearly basis, which is really the time the Earth goes around the sun. It has nothing really to do with the rhythm and the frequency you need to have for yourself as your body clock, isn't it? So can you talk about the benefit of telehealth to really increase that and tailor that to the patient need?
So one of the biggest advantage of telehealth is that, it can be, you on the one hand, you're connecting directly with the patient, which is you're making the clinic visit into a televisit. But then the benefit goes beyond that, and that is where, okay, messaging after that, sending an email, so all that is part of the care, which is asynchronous, but also it helps with getting a better picture of the patient and providing better care. That's number one. Number two, you can also, in a way, you can disintermediate, some of the middlemen. For example, insurance. How UBERDOC is doing. Where you are directly connecting with your customer, a physician. If you think about two most important people in the healthcare system, that is the physician and the patient, right? And so you're connecting the two most important people, and everybody else is, nice to have, but not essential. For that matter, insurance or all the copays and everything else, all this baggage we pile on top of this patient-physician connection. And so you can see how this can make that connection more pure, where you know exactly how much you're going to pay. For example, UBERDOC. Oh, by the way, I didn't tell you that UBERDOC's Paula Muto will be on our meetup next month. She's going to moderate a panel. So I love what you guys are doing. So when you do that, patients will get the full benefit of having a physician in their let's say pocket or close to their heart, because they can connect, communicate, and so that is a big value that telemedicine can bring to the forefront. And we're talking, and the potential to disrupt the business models.
Yeah, and I think that's built on your point also, Willie. You mentioned earlier that I think what you really can see now is the fact that the patient can be far more kind of integrated in their own health. So in a way, we've been building a health system that we're around the providers and insurers today, and we're kind of redesigning it now to be around the patient, and that implies the fact that you can now really bring them in their own care, which is, I mean, maybe you want to talk a little bit about that. I think it would be really helpful.
Yeah, so like Ajala mentioned, is that there is more to a patient than their clinical picture. There is the social angle to it. There is the psychological angle to it. There is the economic angle to it. All those things you cannot. So we are medicalizing a lot of the problems. The reason a person's diabetes is out of control is because maybe they don't have a good refrigerator where they can store that insulin, and so we tend to keep treating the medical side of it, but there's a huge, like an iceberg. There's a huge opportunity which we don't address. Now it's called social determinants of health, but that makes a lot of difference for patient outcomes. So how do we tackle those? And telemedicine is a great way. For example, Ajala is able to send a nurse. Maybe we can send a social worker. Maybe we can send just a helper to make sure that they take their medicines or make a list of their things or check on their food supply. That have to make sure that they're eating the right foods. So those are simple things that we don't think about in healthcare, but they make a big difference for patient outcomes.
And you move to almost sick care to healthcare in a way, and that transition to really be part of your health, and then integrating the patient earlier in the conversation about their own health, which seems so obvious, isn't it, when we describe it? It's pretty very well connected to what UBERDOC is doing, isn't it? Because in a way, Craig, you really are able to really let the connection be in a way that is really matching the need between the patient and the physician, and be kind of intermediating tools that enable that connection to happen. Maybe that's something you would want to talk about, because I think there's an enabling function that is really interesting.
Yeah, absolutely. I think, taking telehealth and digital health technology like out of healthcare and just thinking about it from a technology maturity perspective, I think that, digital healthcare has been around for decades at this point. And I think that almost all of it that you see is designed around providing service for an administrator, whether that's a insurance company or a large hospital system, right? It's designed for the insurance company first, maybe the hospital system second. The doctor is a far third, and the patient is not included in the equation effectively at all, right? And so now suddenly we've got this system where it's like, hey, we've got all these digital technologies, and that's great, but none of them are oriented towards driving value for the patient. And so there's no patient participation in it. And so I think that for the first time, healthcare is being forced to be a genuinely consumer-oriented technology, and that's a massive undertaking that larger companies aren't really ready for, and is going to lead to a lot of innovation from smaller companies as they try to tackle it first from a kind of consumer-oriented perspective. And I think the other thing from a technological maturity perspective is that as any technology marketplace matures, right, there's almost always a push towards consolidation, right? Consolidating how any given user group uses a technology. And so I think that we're going to see that on the telemedicine side, and that's really what's going to ultimately generate that inter-technology, inter-healthcare provided connective tissue. Is the consolidation of the tools that the patients and the doctors use is going to be ultimately how that comes together. And so kind of to get us from here towards that vision that Uli and Ajala are talking about having any of those tools accessible at the right moment, it's going to be about building a consumer-oriented product or consumer-oriented products, and then giving patients and doctors the chance to consolidate them, to engage and interconnect, which gets back to your initial question, how do we get them to engage and interconnect directly? We build tools that drive value for them, and we consolidate them so they're easy to use.
Yeah, and around the patient. So therefore it's when they need it at the time they need it, rather than just on this very artificial kind of like overarching rule for everyone, isn't it? So now we've been personalized as well, that come in the picture as well, which is really interesting. And I think a lot of so back to Uli's and Ajala's point, where you're talking about the people that can come in, the nurse that you mentioned, Ajala and Uli as well, but I think there's a lot of conversation about health coaches as well. Then it can go beyond just the nurse, can really be taking care of the patient on a very routine basis about stay healthy, rather than taking care when they really, it's almost like sometimes late and sometimes even too late. Both being ER doctor, I'm sure you know that better than anyone else. In terms of one of the big option and opportunity for telehealth and telemedicine that's being talked about a lot is chronic disease, isn't it? So it touched 133 million Americans have chronic disease, 40% of the population in some ways suffering from it. What do you think is the benefit of telehealth, telemedicine? And I would love your point and discussion on that. What can you bring to that population, which is so important? I think 90% of the cost of medicine today is around that population. So an interesting topic. You want to start, Ajala, to talk about that?
Sure. Did you say Crohn's disease?
Chronic disease, older chronic patients.
Okay, chronic disease, yes. Yeah, I think that, with telehealth can be so broad and accessible to really any healthcare professional. So that goes with dietitians and nutritionists and, we mentioned social workers. And so it doesn't have to be just locked down to a physician, but really just other members of the healthcare team, more like a holistic approach. Definitely, there's a shortage of primary care physicians or preventative health physicians. And so be it that there's a shortage of these doctors that are very crucial for patients with chronic diseases. I think the telemedicine can help reach more patients, since we have less physicians for chronic issues. So I think that's very important. And yeah, and I've always said that, you can judge the state of our healthcare with how the ER looks. So,
Yeah.
Not unknowingly, I only graduated from residency like 3 to 4 years ago, but I didn't know that I'll be taking on a primary care provider role as well. People not being able to get to their physicians, even in the case of when they do have a primary care physician, because the physician's booked out like 6 weeks, or they just don't have a primary care physician. So the ER becomes really like catching that for them. So I do think that, and in the ER we're limited to what we can actually do. We don't truly give preventative health to patients, although we do the best that we can. But I do think in expanding telemedicine, it can just give patients more access to their providers, and that includes nurse practitioners and physician's assistants, just taking on a more active role in giving preventative health care, because there is a large shortage of primary care physicians.
Yeah, and I think they said that 20% of ER visits can be maybe taken out or reduced to telemedicine as well, isn't it? So that's really building on what you're just saying.
Right, absolutely.
And Uli, from your standpoint, how do you see chronic patients being addressed with that new ways of thinking? Because that can really be a big transformation vector, no?
Yes, definitely. So I like what Ajala said, is that when you look at, the way I describe emergency department is, it is a failure of the health system when you see a patient with emergency. Emergency department should be like the fire department, right? You have to figure out how to prevent fires, not be continuously dealing with fires every day. You're more like as a backup, as an insurance. So that brings to the point, about how does our system help or hurt preventive measures? When you, for example, when you start paying physicians for a visit, or when you start paying physicians for a procedure, or for an operation, or for a test, or you're paying them for a prescription, that means you will get more visits, more tests, more operations, more procedures, right? But you have to, in healthcare, I'm also a public health practitioner, so I understand that in healthcare you have to go upstream and see how you can prevent those things from happening, which is most of the preventive stuff. But so even telemedicine, if it is being paid per visit as a reimbursement, that means that you will get more telemedicine visits. Whether that makes a difference in the outcome or not, that's a different story, right? But imagine if physicians are paid, per patient, you take care of this patient, we'll pay you $10,000 per year. And then you are utilizing the physician's full scope of knowledge on figuring out solutions. The solution could be that maybe the patient needs a person to help them at home, and that'll prevent them from missing their insulin dose. That might prevent them from ending up in the hospital, which is very expensive, showing up in the emergency department, which is also very expensive for the system. And so, the way we think about each of these disease processes is very important. Let's say, for example, Yeah, that goes with infectious disease. That goes very well with chronic disease, because how do you prevent these disasters from happening in the future? And so for that, obviously, you need the digital health, digital technology to be able to capture data.
Mm.
You need data scientists, to be able to analyze that data and come up with, analyze and show it. And then you need medical science, the physicians, where they can say, okay, we tweak this here. 2 years from now, there will be less heart attacks.
Yeah.
So less ER visits or less hospitalizations for this patient. So that is where I think the biggest bang for the buck comes, where technology, machine learning, and artificial intelligence, where you can use that to be able to keep the patients healthy and decrease the downstream costs of healthcare.
Yeah, and one of the misconceptions I think really that you were talking about is how people don't realize how much healthcare is predictable. Like you have so many ways that you can really predict what will happen to someone way before it happens, isn't it? If you had only that relationship. Which brings me, I think, to my point with Craig in the sense, so if the patient now start deciding when they want to talk to their doctor because they go on UBERDOC and pick the doctor they want when they want to, how do you build that preventative measure? How do you create preventative health with a platform like that and create that relationship long term?
Yeah, that's an awesome question. So my brilliant wife is an MPH and also has been in consumer apps and is a head of product at a consumer app company. And it's really amazing to me like how similar public health and consumer product management are, right? They're both really about how do you use some forum or mechanism that you have to change user behavior to make numbers move in a way that you want them to move. Right, that's the core of product management from a consumer perspective. And it's also, again, I'm not an MPH, but it seems like the core of what an MPH is about. And so, there's like your leading and your following aspects of looking at behavior, right? It's how do we use this tool to guide the patient towards what we want them to do? What are the incentives we can use? What are the mechanisms we can use? What does user behavior in digital technology tell us? And then there's also the following side, right? It's let's observe the user's behavior. Let's observe how they use what they have today and use that for inferences of how we pull them forward. And so I think that like, as we look at the future of these consumer health tech companies, and I think of UBERDOC specifically, it's like having that MPH mindset is going to be critical, right? If we're about creating accessibility to healthcare, we can't just be about creating accessibility to healthcare. We have to be about creating accessibility to good healthcare, to positive healthcare outcomes, and having that MPH mindset of, okay, you provide access to an annual visit, but how do you encourage people to have an annual visit, right? Because that annual visit is going to be critical. You encourage people to book an appointment with a nurse to come in and do things. Well, if that person's falling off, how do we use technology to encourage them to participate in that behavior? I think that if we can use, public health ideas to drive the goals and then use product-oriented ideas to drive the user behavior, there's a great amount we can do across a myriad of technologies by using that approach to lead to the outcomes that you're kind of alluding to.
Yeah, and I think just to be very practical on top of it, I think one of the big statistics in healthcare in the United States is the fact that a third, I think, of Americans don't get healthcare because they're worried about the cost. They're worried about the surprise bills at the end of the day, isn't it? So, like, I think just being able to have that transparency in pricing and access is maybe a very big enablers as well. Maybe, Craig, you want to expand on that? Because I think that's really in line with what you're trying to build.
Yeah, absolutely. Balint looks like he's got something to jump in.
Yes, Balint also, I think, has a question, a point to make. Please jump in. You muted, Balint. Yeah.
Yes. Thanks, and I would like to join to your points and what Yuli mentioned. The business model of healthcare nowadays. It provides a different aspect what the patients really need, and let me add one more thing how telehealth can help to patients to have a better healthcare, and using the IoT devices, the wellness trackers is still accessible nowadays, and there are a lot of opportunities in this. And if we can save time for doctors, it can be the next step. So what we can see, the first step in telehealth is to have a channel between the doctors and the patients in real time. But with this, we can solve the distance and the travel problems, but we can't solve the time problems that physicians are extremely busy, and they can't work even more despite it's remote or not. Yeah. So the next step should be save time for the physicians and help people with asynchronous solutions as well, and to train people to prevent serious problems. And if doctors can use proactively more IoMT devices and even can promote more wellness trackers, and somehow they can monitor it, then maybe it's possible to save much more time for the doctors with a wider network of software and hardware solutions.
Yeah, and I think that's a really great point, because then those wearables also means that what Uli was describing about really integrating the patient in their care and their health as well. And so once the patient is really engaged in measuring the metrics of what's going on in their body that they might not be aware of, that's the right time they can basically engage on choosing a physician, or reaching out to a physician and choosing the best care for them. And I think the cost factor of it on top of it is a real hinder that I think UBERDOC and Craig, you're trying to solve as well, isn't it?
Yeah, absolutely. I think that from our perspective, as we got into this marketplace, we were in a position where we had to say to patients, like, you should pay cash, right? This is the opportunity that you need. This is faster access. This is more open access. Between your copay and your insurance and referrals, it's cheaper access, right? We're pushing forward the idea of cash pay as an accessibility option. I think that as we grow, our vision is not to push people towards cash. Our vision is to always be available when a patient is making a healthcare choice about whether or not to buy, whether or not to access, and just say there is a place you can go where you can see a transparent cash price. And I think that by making that available, you're not asking them to spend money that they wouldn't have spent otherwise. You're not asking them to really change their shopping behavior, because when they're shopping for anything, you pull up Google on your phone and you look at how much it costs, right? It's the first thing anybody does. So you're building into their existing behavior a new option. And we just want to be there, right? We want to be available and let people choose how they want to buy their healthcare, right? So that the next time they go to think about what insurance they're going to plan, next time they get to open enrollment, or with their insurance that they have to decide, am I going to go to the doctor or not? Am I going to get that lab or not? Being able to see a transparent price is going to be a positive motivator for all of those people to get the care that they need simply by being able to see it. And that's the long-term vision that we're working towards, that I think really does meaningfully move the needle on accessibility by giving them confidence before they go in.
Yeah, and the virtue of that is that now you're not limiting your care because of cost. And at least you will, because of the worry of not having a surprise bill, because of the worry that might, in the end, really put me in a tough spot. The fact of having that transparency upfront means now you know what you're going to get, and therefore you can really reach out for that care when you need it, isn't it? Which I think is really an interesting point as well. And so let's segue now a little bit on limitation and so we all agree on the benefits and the potential that has, but what is limiting today? What has to be built now to really make that reality even further and more present in our daily lives? And really you had some point about that, or what you think needs to be changing, especially from the business model standpoint and so forth. Do you want to expand a bit on that?
Sure. So if we, like I said, the payment for services needs to change. because if we are paying for a specific service, you get obviously more of that service, whether that is benefiting the patient or not. For example, Craig was talking about annual visits. Why do we have to have annual visits? Does it, should it be 9 months? Should it be 6 months? Should it be monthly? Should it be weekly? So if you set a price for an annual visit, so people will tend to push for annual visits. Maybe it should be every 5 years. Maybe there should be a way where the machine is watching you, monitoring you, and just giving you hints on what you need to do to stay healthy. And maybe you don't need a doctor's visit, maybe every 3 years. So we cannot treat everybody the same way, because everybody is in a different risk category when you talk about health, right? One patient may be that, if you don't take care of his hypertension, is going to have a stroke in the next couple of years. So maybe that person needs more intensive outpatient treatment, more intensive monitoring, right? So we need to focus on those folks based on their risk profile, and that's where the data science, where I think is very powerful, is because you don't have to treat everybody the same way. You don't have, it's not cookbook medicine, but it's much more powerful. You're customizing the care, the interventions, the actions, whether it is physician visit, whether it is lab test, whether it is just monitoring a diet, or whether it is an app for anxiety, right? All those, or depression. For that, you don't need a physician. Maybe you can set it on automatic, where it is managing their symptoms of depression and loneliness, whatever that may be. Because that has a bearing on the health outcomes. That has a bearing on how often do you go to the ER. Maybe that person just wants to talk with somebody and goes to the ER. We have seen patients, who just come in every few weeks or every week just to say hi, and they stay overnight, and then they go home in the morning because they're so lonely that they get all these symptoms, and they're worried about having a heart attack in the middle of the night. So those are the kinds of things where you're stratifying every single member based on their risk, and really fine-tuning the care to that person's risk, to that person's needs. And then, whether it is physician-delivered care, whether it is hospital-delivered care, whether it is, a helper-delivered care, you can really customize the process. And so that's where, I think the future is. That's where you can get the biggest bang for the buck.
And you make a really good point. Go ahead, Ali.
And then that changes the business model, obviously.
Of course.
You can't pay per episode type of care.
For sure. And you were mentioning something, a really good point. I think I want to make sure I highlight the fact that maybe telemedicine, telehealth traditionally hasn't really included mental health, but it can have a huge potential for mental health as well. And I think we should really make sure to integrate it, especially in a comprehensive, exhaustive view of healthcare, isn't it?
True, very true. And how do you deliver that? Does it have to be a psychologist, or does it have to be a social worker? Does it have to be a patient's, daughter or son being on the call, right? That just that fact that a person who is 2,000 miles away can join you on a call, that might give an older person reassurance that, oh, okay,
people care.
My son or my daughter is watching what is happening with me, so that might help them relieve a lot of those symptoms.
Yeah, no, of course. And Ajala, you were mentioning about the legal aspect on the limitations that really have to be taken into consideration and adapted. You want to expand on that point?
Yes, I know for myself and some of the colleagues I was talking to, in regards to telehealth, telemedicine, is that, as we're always concerned about getting sued. And because, there are some limitations, as I was speaking about, like, you don't have all your senses there when you're video chatting with a patient, especially if it's a new patient as well. You may not know them as well. The rapport may not be there immediately. And so, I think really just laying out the expectations to the patient, just saying, we're doing a telehealth consultation. There are some limitations as to what I could do as far as examination wise, and just letting the patient know that, there are some, just naturally, there's some limitations that will be had. But also as far as, kind of like what you can work up as well. So, depending on what the visit is about, if someone comes in with like, sinus pressure, things like that, it could just be like a clinical diagnosis. You can prescribe, whatever therapy for that. But if it's, let's say it's an older patient with more medical problems, I think as a physician, you're concerned that, well, what if I miss something, over a conference call? Or, should I refer this person to the hospital or the ER, or just tell them to come into my clinic? So these are all questions that I think a physician will have in their mind when they're assessing a patient. Just because we live in a very litigious society, and so someone who's new to telemedicine, I think that is a major concern as far as liability is concerned.
Yeah, no, absolutely true. And I think there's another big issue as well, is your integrations, and how can we integrate all those systems together. And so, Craig, I would love your point on how do you think you're going to have UBERDOC being connected interweaving into the tissues of healthcare and the systems today. How you think about that?
Yeah, absolutely. It's definitely a big one to tackle, because like if you look at where data lives and where data transfers in our market, it's effectively built by people who want to hoard the data, right? It's not built by people who want to share the data. It's built by people who want to hoard the data. And so all of the systems have been built around that. And that's just a specific example of what we talk about when we say, it's not consumer-oriented technology. Like that's a perfect example of how and why that exists. And so I think that, coming from the outside, we're in this really unique space in technology where all of a sudden, like all of these companies and technologies are built off of APIs, right? And so for people who don't know, APIs are just a structured way to send data to and from platforms. So it just gives you a framework to send data to another partner or send or get data from a partner, right? And so all of these new technology companies are built around APIs, right? The idea is you can partner with anyone to send data back and forth in ways that support your business. So we've got all of these new technologies who are building in that mindset, and all of the old technologies in the EMRs who are getting forced in that direction. I think the thing that we have going for us, and the thing that we are looking towards at UBERDOC, is these EMRs have built silos, and these large hospital systems have built silos so that their competitors and other people can't get in from the sides. But we don't need to break down all of those walls if we can reach in individually to each of the EMRs and pull out what we need and consolidate them in another place. And so that's what we're looking towards at UBERDOC, is how can we over time build integrations out, so whether it's a e-prescribe software that they're buying their data from, it's an individual doctor who has their own EMR. If we're a consolidated buying hub, we can pull that data together. And so I think ultimately the data winner in this space, winner being defined by the person who successfully aggregates and provides a centralized hub for patient data, is going to be somebody from the outside who's able to reach out to all of the places and pull it together. And that's going to be necessary if we want to make all the technology integrations that Uli talked about, and Ajala and myself and Balint about bringing the technologies together. That data is going to have to be the thread that makes it happen successfully.
And the exciting part and credit on that note is, of course, the ONC data blocking rule in March, isn't it? That's it by August next year. Data from EMR have to flow to APIs, as you rightly mentioned. So I think that opened up a whole new interesting venue for telehealth. Balint, you had a point that you want to mention on that notion of integration.
Yes, thanks. So what Craig mentioned is that we already have a lot of technology solutions, a lot of great solutions, but it's changing every day. And a big bottleneck to make the health system better is the education itself. So we already have a lot of great solutions, but we barely use them and not use them on the best way. So what would be a great help for the doctors is to have them choose the right tools, to train them how to use them, and to have them having the new digital first care mindset. And on the other hand, to have the patients to be more proactive, to care more about their own health, to use technical solutions themselves, to monitor themselves, and to make a conversation with the doctors, not just wait for a solution, but make a real conversation, a real cooperation with the doctors, and we technology providers must help the two main actors, the doctors and the patients, to understand and to learn the technology, how to use it on the best way, not just to develop new and new solutions. This is what I would like to add to the aspects how we can make the health system better.
And that's a great point. I think that brings what Ajala was talking about, the fact that it should be at a residency level, isn't it? Today, you don't have any of that, as you were mentioning. And so I think we have only 4 or 5 minutes left. And so I just want to make sure that we can cover for me an interesting conclusion on all what you built on. It's like, so in 10 years time, I know we don't have too much time, but I hope we can have your thoughts on that. In 10 years time, what do you think an MD patient looks like? What will be we're just starting this revolution now. How far is it going to go and how it can evolve? And so if you can, please limit your answer, because that can be a half an hour each of you, I'm sure, answers. But just in a short view, what do you think that could be? And so love to have your thoughts. And I'll start with you, Yuli.
Sure. I see 10 years from now, if everything is going the way it is going, I see the role of physician as the, I would say, air traffic controller, where there are people working in the planes. There are, nurses, social worker, and they are managing many planes. They are looking at the big picture, and they are using technology to advise, whether it's the pilots or whether it's the ground crew or whether it's the gates. And they are managing the whole thing from a central place where they can look at the big picture. That's where I see and data driven. Really helpful.
Thank you, Ajala.
In 10 years, I hope to see a more integrated electronic medical records that span beyond different healthcare systems. That is really centered on the patient. I don't want to be a pessimistic, but it's I think because of these health insurance companies really, and how the model is not patient-centered, it will still take a lot of change for that to come. But I do think that with the pandemic and with the switch to more technology, more centered, patient-centered care, we're going you're going in that direction, but I'm interested to see how it'll actually pan out.
That's wonderful. Craig?
Yeah, so I see kind of consolidated access hub for patients that don't define what the care is or how it's paid for. They just define the entry point. And then the remainder of the elements of your care are going to be highly interoperable. So whether it's you want to pay for some things in cash, some things in your HSA, some things through your insurance, it's going to be completely interoperable. And the same with the care, so that if you need a home nurse, if you need delivery or pickup, whatever it is that you need should be highly interoperable. So all of the people touching your care don't have to be in the same system, don't have to use the same technology, because your access point is the same. And everything that happens after that is consolidated within, regardless of what things you're specifically accessing or using.
That's really interesting. So we have a really interesting viewpoint between the three of you, between like patient-centric design, full integration, and full interoperability as well. I think that's really interesting. Unfortunately, we have time. So I just want to make sure that if you are interested of really finding amazing doctors and build incredible startup, please talk to Uli about InnovatorMD. If you want to move about telehealth and especially home health with Ajala and UBERDOC, and really try to build a new version of new way of doing medicine at home on those important patients, important disease, that will be wonderful. And then of course for UBERDOC, and I think UBERDOC, Craig said you're fundraising soon. So I think that's the right time to reach you out if people want to be involved in that space. And also Balint, I think you said there's a networking club for Bene Studio. And so maybe you want to conclude on that point to just give a little bit overview on that for 20 seconds.
Yeah, thank you very much. So I really hope that with the Telehealth Networking Club and with the mostly Rapidconfs, we can help to the community to be even more digital and to increase the speed how we can transform healthcare into a more personal, more patient-centric state. So I hope we can help in this to all of you.
And I think that's a very true point. I think what came out to the panel is really the need of so many different skill sets to come together to make that change. And it takes all of us to come in this new world. And so really, if you want to reach out, please do so. What an incredible panel. It was so interesting to talk about this fascinating subject. If you had any doubt about it before, I hope that's now you're convinced that's the future and you to jump in as you do now. Thank you very much.
Thanks, everyone.
Thank you.
Yeah,
Bye-bye.
Bye-bye. Thank you so much.